working in the system for almost 25 years now. I've seen a lot of changes. A lot of them are not for the better. There is a huge impact on myself and my colleagues, on the patients, and it's a real issue, and we really need to think about what we're doing. And the people who are making the decisions don't tend to be healthcare personnel, and so that never makes any sense or tends to work out.
The problem with funding hospitals less than the rate of inflation is the accumulation of that, and Natalie mentioned it, is the Commitment to the Future of Medicare Act, where hospitals can no longer run deficit budgets. And what's happened so far is extensive rationing of services in many areas, including layoffs for hospital staff and not replacing hospital staff when they are ill or absent, or if they happen to be off, for instance, on a maternity leave for 1 year, those positions are no longer being filled, so they are vacant. That means less people are there to deliver the care to the patients that are in the hospital. Over the last 18 months in the province of Ontario, we have lost over 2,300 RN positions. That's over 4 million hours of registered nursing care in the province of Ontario. That's huge. It's absolutely huge. It's also meant having to travel further to access hospital services because of the closures in emergency departments in some of our community hospitals for services that are no longer delivered. If you are frail, if you are sick, if you are unwell, if you don't have a pal, buddy, family member, it really doesn't matter where in this province you are. It is not easy to travel long distances on transit, in a car, on a bus, and a train for health services. It isn't easy. And these hospital services are being centralized. Hospitals are in some cases, as you've heard about, particularly in Niagara and some of our northern communities, are closing down or closing down at midnight or only being open during certain hours. Because they can't operate on the dollars that they receive to provide the 24-hour coverage and the services required for their community. And they're having to say to their communities and to the people in the surrounding areas, I'm sorry, but you have to go down the road because we can't stay open past midnight any longer. Or we're closed altogether. It's urgent care only from 8 to 4, Monday to Friday, and have a nice day. But what some of these wait time strategies are doing is moving patients from the emergency departments into hallways and into linen closets and into utility rooms, anywhere where there's a stretch of hall space but out of the emergency department, because the reward is about getting the patient out of the emergency department. So if you move the patient in 4 hours, uncomplicated, out the door, $100. If you admit them to the hospital within 8 hours, and that could be anywhere, like it's loosely based what admission means, $500. So, wow, so that's pretty clear about how we're going to move that forward, because the more you move, the faster, the faster, the faster. Doesn't mean working better, it's about working faster and getting those patients moved. In Britain, when they did this, when they started this, and this isn't about saying they've done it right, because certainly it's been quite disastrous, but when they went into this pay-for-results funding, they increased their healthcare spending. They had more money going into the system. So they moved to this funding model in an era of massive increases to their public funding of the public hospitals. And the annual health budgets in Britain doubled during that time when the pay-by-results funding was first introduced. So from 1997 to 2005, they doubled the funding that went into their public hospitals. Still didn't work, mind you, but they doubled it. So here in Ontario, people, I guess, have decided this is a good idea. So we're not only are we going to do pay for results, but we're also going to reduce the funding. So let's see how that goes. I suggest to you it's not going to go that well, and it's not going that well. So in short, payment by results funding turns out to be much less efficient than the global funding because of the added admin costs as well, which has already been described to you. When I started working in my hospital, we had a finance department that sat on, there was probably maybe, it's a fairly big hospital, 20 people or so. That was the day of the old punch cards, all that kind of stuff. But you know, they worked hard and they had to report to the government certain things. Now, let's be clear, I know that there was lots of excess in our system at that time, and things were pretty loose. I know they were pretty loose. over time, the reporting requirements, coding requirements, data collection, all that stuff has grown. And now there's an entire 6th-floor building at my organization, which is nothing but finance and admin and coding and reporting and statistics. Those dollars to provide that service of reporting and to pay those employees comes out of that global fund, which is what we hear about the healthcare dollars. So that money to support the admin services required to operate our system now is out of our healthcare budget. And I might suggest to you that that's pretty far away from the front line where healthcare is delivered. So no one believes that there should be waste. No one believes there should be fraud in the system. No one believes we shouldn't report statistics. However, let's talk about it. Let's do an apple and apple comparator. Let's talk about what we're actually spending healthcare dollars on. Make sure we're spending it in the right place and for the right reasons. And let's not paint it in a pretty picture. Let's not call it things that it's not. Let's just worry about looking after Ontarians and their healthcare. Let's not get confused by the technobabble that's going on. Things are changing here fast. We need to pay attention, and we need to say when it's not okay. And we need to say when things aren't right. And as healthcare providers and as a nurse, and my role as a registered nurse licensed in Ontario, I need to be a patient advocate. So yes, I'm a union leader, and I'm going to talk about that, but as a patient advocate and as a registered nurse, I'm going to say this is not okay. This is not okay to reduce services to Ontarians. It's not okay to have lack of access for Ontarians. And we need to stand together and to start talking about that really loud and clear.